Discover London Bicycle Cafe. It's the perfect time of year to take a break on their spacious patio, featuring craft beer, espresso drinks, snacks, meals, and more. London Bicycle Cafe at the Forks of the Thames. See you soon.
Hello, London. Welcome, or welcome back, to the Matt Brown Podcast. Please remember, this podcast is for you, and we want to hear from you. Maybe you have an idea about a show. Maybe you have a comment on one that's previously aired. Reach out. You can email us at TheMattBrownPodcast@gmail.com. While you're at it, consider subscribing to the show, wherever you listen to your podcast. If you got the first episode, you know this show is a kind of two projects in one. Starting this fall, I'll be hosting Newsmakers on Rogers, Channel 13. Newsmakers will be taped twice monthly and will focus on all things local, and maybe some other stuff too. Each show will feature one or two London leaders or newsmakers of the day or the month. The interviews will be long form, 15 minutes or 30 minutes, which will allow us to dig a little deeper and to develop a greater understanding of the issue of the day. That's project number one. The second project is what's currently in your ears right now. After the Newsmaker episode airs on Channel 13, some of that content will be replayed in podcast form here. That's the starting point for the Matt Brown Podcast, which means if you subscribe as a listener here, you can be guaranteed a minimum of 2 podcasts per month beginning in September. Plus, on top of this, I'll be doing some podcast-only interviews as topics present themselves. That's what we have for you today. So let's go. I don't have to tell you that London has a homelessness crisis. You might not even be surprised to learn that our city has almost 2,000 people experiencing homelessness right now. And of course, this is not just a challenge for London. Ontario has over 80,000 citizens living rough, and the whole of Canada, over 250,000. Homelessness is largely an issue that's been with us for about 30 years. Post-COVID, the crisis has exploded. Here with us today is Chris Moss. Chris is the executive director of a not-for-profit called London Cares. This is a largely City of London funded organization that's part of London's homelessness response system, City Hall's strategy to address homelessness right here in London. Chris and her team run a number of programs and services. They partner with the city, with the London Police, with the health unit, our hospitals, and many others to support folks who are living rough, to find them housing, or even keep people who are at risk of losing housing housed. Welcome to the show, Chris.
Thanks for having me, Matt.
We're really looking forward to having a conversation and giving you an opportunity to allow Londoners to learn a little bit more about London Cares and what the organization does. So my first question for you is that 40 years ago, there really wasn't a housing and homelessness crisis. What happened as a community and as a country? How did we get where we are today?
Yeah, you're right. I know, thinking back, I remember the days when, volunteers and church groups would gather together at soup kitchens and cook and distribute food. Oftentimes, volunteers would take food to the street or blankets or knit things and hand them out. It wasn't a lot of complexity to it. At times, it was mostly just transient men in the system, right? And within London, we have about 400 shelter beds, and so we didn't really max them out. People had a place to stay. You didn't see a lot of people on the street, and certainly not the complexity we do now. So since, I want to say, the mid 80s, we've really had a growth of complex issues that have kind of broken down over time, right? So housing has slowly gotten worse. The costs have gotten higher. Vacancy rates have decreased. We haven't built new homes. And if we have, we've not built affordable homes. We also know that the complexity of mental health has increased. So now the care that people who are unhoused need is highly complex. You need social workers with so much training just to navigate the questions that they bring. You need primary health care, you need security, you need police enforcement, we need treatment, EMS, fire, addiction, mental health supports, and treatment centers. This is really just
Wow.
years of chronic underfunding in several areas.
Okay. It sounds incredibly complicated.
It is.
Um, and when we look at lending cares,
Yeah.
what does your organization do? How does it try to help address these issues that you're describing?
Mhm. Yeah. So it was started in 2012 with four agencies that came together who noticed an issue for needing some outreach folks. So we partnered with the city and we would go out and meet with people and had like under 20 staff and it was easy to manage. We now have over 100 staff. Within our organization, we
I had
have
no idea it was that
it's
large. 100
huge,
staff.
100 staff.
Wow.
We have at any given time two teams for outreach out in community. We have street outreach people who walk the streets and just help with support when they see it. We have encampment teams that are deliberately out in encampments working with the folks, helping them get their paperwork for housing, helping them get ready and into the system. We do crisis outreach where we respond with the city's CIR team, police, EMS, etc. And we get well-being calls and crisis de-escalation calls with them working in partnership. We also have a phone triage system where we have a phone number people can call and they can reach out for support and that person can navigate them to shelter and access to food and other things.
Well, I hate to
And
put you on the
then,
spot, but
yeah,
people might be wondering as they listen, oh, there's a phone number. I didn't know that. Do you have it handy or can you provide it and I'll put it in the intro?
yeah, definitely. Our phone number is 519-667-2273. It's a great number to
And
memorize.
people can call that number 24/7?
24/7. Yep, our outreach teams are on the street from 7 a.m. to 2:30 in the morning. The phone is manned 24/7. So if anyone needs supports during the evening, they can talk to our teams.
Okay. Okay. So that's what you do.
That's
Um,
one program of what we do, Matt. Over and above the outreach programs, we have three other programs. So we run an operation out of 602 Queens, which is called our Commons. This is a partnership between Regional HIV/AIDS Connection and the Sisters of St. Joseph. In this space, it's a day space where we offer basic needs, primary care, OW, ODSP support, cultural indigenous services, vet care, food stability, AIDS and HIV testing, and so much more. We have space for 30 people in the morning and 30 people at night, and we're getting roughly 120 people to our lawn every
oh,
day for those
that is
spaces.
so sad. The numbers,
It's devastating.
yeah.
Our numbers are only going up, and it's getting really, really challenging.
So important work, great
Important work,
services, not nearly enough
not
to
nearly
meet the
enough.
need.
So, as a housing first organization, the other two programs we have really focus on that housing component. So, we have housing stability workers that once we get someone who is living street level into a house
Okay.
anywhere in our
Hmm.
market community, housing support workers wrap around them to help them stay in housing.
Right, because
That's
it's more
really important.
complicated than just finding
So
a place for
complicated.
someone to stay.
Yeah.
Once they're there, it's supporting them with the supports that they need. I'm sure wraparound supports, all kinds of supports to help them just stay housed. So we
Yeah.
get a person housed and then
That's
help
right.
them stay housed. I
Yeah.
gotcha.
If you've been on the street for up to 10 years, it's really easy to forget that you have a garbage day to make. And how do you get your garbage? Where do you put your garbage? Are you cleaning yourself every day? All this stuff has to be retaught. And so that's really an important way for housing stability workers to work. We also have two of those housing stability workers that work specifically with veterans. And we have a partnership with the Victory Legion, and we house 295 unique individuals within that veterans program. We were the
Okay.
first community in Canada to have zero veterans on our street. So it's a really exciting program.
That's something that, you know what, that is something to be proud of.
Really
In
excited of.
in all of the work that you do, your team
Yeah.
must experience so many situations that are disappointing
Yeah.
or they feel like they can't do enough. But to know that every veteran is
Yeah.
housed is,
Yes.
I think,
Little
really
bit of
important.
joy. Yeah. Finally, after years of our outreach folks working with folks on the street, several of them had the idea of building supportive housing. So that outreach team who had been with folks for almost 9 years worked with London Health Sciences Center to figure out who are the most most complex, challenged people living on the street, and how can we bring them indoors? And so last year, about 18 months ago, we opened up House of Hope on Dundas Street. House of Hope now houses 56 folks. All of these people have had incredible outcomes, and we have a great evaluation on our website to show you that detail.
Awesome. So that's what you do. It's an impressive amount of different programs and services. I know because I looked it up on the website before our chat. You have a $6.3 million budget. So who are your funders, and how much of that funding is provided by City of London, for example?
Yeah, great question. So last year in total, so 6.3 was in 2023. Last year, 2024, 7.2 million. 4.2 of that was the city.
Okay.
So the other funders that make up the difference is London Health Sciences Centre, United Way, London Community Foundation, the Royal Canadian Legion, regular donations from community citizens and
Well, that's important for people to know, right? That
corporations.
that
Yeah,
they can give.
they can donate at any
I
time.
imagine there's a button right on the
There
website.
sure is, right in the
Okay,
top
and the
corner.
website is?
Yeah, www.londoncares.ca.
Okay.
The
Well,
other
hopefully
piece,
after people, hear this interview and about, what London Cares does, that some people
they'll
will
come and donate.
think,
I would
I'm going
love
to
that.
come, I'm going to donate. Yeah.
That's great. The other piece that surprises people is that within our House of Hope, we do charge rent. So people who live in our house pay rent. And so from the House Supportive Housing rent, $310,000 is received per year to fund that program as well.
Well, that's actually a really important piece of information because, often we'll hear negative comments about, they must receive some kind of money from ODSP, for example, or some other income source. And so,
Yeah,
so why should the community have to pay for everything? And what you're
that's right.
telling us is that's not
They
the
don't.
case.
That's correct. Yeah,
And United Way, I know, funds a small portion of your budget.
that's right.
Okay. And you mentioned the London Community Foundation and those private donors that we were just speaking
That's
about.
right. They were excellent with supporting us.
In your most recent audited financial statements, I see that the London Health Science Center is also a funder. They've come on board, and the statement that I saw to the tune of about $600,000, just under 10% of your overall budget. And so, why would a hospital funding an organization that's set up to prevent homelessness?
hmm Yeah, this was a really unique partnership that our staff and the hospital staff came together and recognized that housing is healthcare. If we could house folks, will that decrease the usage in the emergency room? And after a year, we have proven that that is true. So, folks that have used our programs were 6 months before coming into our house. They had been in the emergency room for over 200 times. After moving in, under 10 times.
Hang on, say
So,
that again.
yeah. So, for 6 months before moving in, they had
Right.
been to emergency room over 200 times
In 6 months.
in 6 months.
Okay.
After moving in, for the entire year post moving in, they had under 10.
That is
So, it's
incredible. I don't know
significant
what
cost
it
savings
costs
to
to
the
visit
system.
the emergency room, but I'm
Mhm.
I'm sure it's a lot.
A
And so
lot.
each time a person is diverted away from
That's
emerge and
right.
supported in another way,
That's
it's
right.
got to save hundreds of thousands, if not more, in terms of
Yeah.
healthcare dollars.
And more importantly, it frees up the emergency room for the people who need to be there. So that
Right.
is
Yeah, of
what's
course.
so
Yeah.
essential. On top of the healthcare, we're also saving money from the jail because it's diverting costs from people being in jail. So the same numbers exist from that sector as well.
Incredible. Okay, so you're kind of describing a continuum of support. You meet people where they're at. You help them move along to a better life, a more satisfying, fulfilling, health-focused, better outcomes. And so I get the theory, right? So we're moving along a continuum of housing, and then remaining housed, and then hopefully transferring individuals that require high acuity support to lower acuity housing, so that you
That's
can
right.
move people kind
That's
of
it,
kind of
exactly.
throughput through the system. So I
That's
understand the
right.
theory,
Yeah.
but does it really work in reality?
Yeah, yeah, absolutely. We see that it does. So the whole of community response that we've been working in has created these partnerships that have been really essential to helping this work. So the flow goes from street to home, right? So our outreach workers find people, they come into our day space, we connect them to paperwork, we get them identification, we get them on all the right lists. They get into something like a House of Hope, for example, and then we have them in that space, stabilizing, teaching them how to live independently, and then we get them to graduate. And we've had two people graduate in a year now.
Graduate. I like
We
that.
did
Yeah.
not see that coming. We thought this would take years. And in 1 year, two people have graduated. And so then what happens is they move into the rest of the system. So towards Indwell or CMHA supportive or affordable housing or other types of affordable or market rent, right? So it's freeing up places in the system, which is helping people move along.
So we're we're just about at the end of our time here on this podcast. It's been really informative. It's been difficult, of course, to listen to some of the information that you're sharing because these are human beings, community members, Londoners who are really suffering. And I think that, the fact that your organization is called London Cares is very interesting because London really cares about homelessness. When you look at the survey that CBC London Radio conducted back in 2022, just before the municipal election, to identify, what are Londoners' top issues? Well, it was housing and homelessness. 54% of Londoners said that that was their number one issue. Uh, the current mayor and council, they've made some significant commitments and investments in this area. One could say that our city council has made these two challenges their top priority. Well, I mean, that and of course the increase in the police service budget, which was unprecedented, up to about $780 million, I think, over a 4-year period. So I'm getting to my question. Senior leaders have been charged with solving this problem. And they've told council and our community at the time when all of the work began that massive multi-million dollar investments are going to be needed to alleviate homelessness. Things will get worse before they'll get better, is a comment that I think I remember hearing, even if this is front end loaded with a lot of resources. So it's reasonable, I think, to think at this point that we're able to see if the needle is moving in a certain direction. You've been at this for several years with the whole of community partnership. So I guess let me ask you this question. Today versus 2022, has the number of people experiencing homelessness gone up or has it gone down for London?
Hmm. Sadly, it has gone up. And sadly, we see it going up every month. So last year, our outreach team had 10,000 calls in a year. This year, to date, we're in July, end of July, we've had 13,000 already.
Oh my gosh. So over a 12-month period, 10,000. This year, we're about halfway through.
We're
Uh,
already higher.
and you're already at 13,000.
Yeah, and Matt, we're seeing 50 to 80 new people fall into homelessness at the beginning of every month. So what's happening is the tap hasn't been turned off. So rent control, seniors who don't have space in long-term care, people in matrimonial relationships splitting up and not having the ability to afford rent on their own. And so single moms with kids we're finding on the street.
Oh my
The
gosh.
OW and ODSP rates, the inaffordability of housing, the lack of vacant space. And so while whole of community is working in the sense that there's a lot of spaces coming on board in the coming year, currently there are still no spaces. We have over 2,000 people on the street, 400 shelter beds. We know that we have no treatment from Windsor to Waterloo and up into Bruce County. There's only 54 treatment beds. We do not even have medical detox in our community. We have to drive our folks to St. Thomas, Sarnia, or Windsor in order to get detox. And then when they come out of detox, there's no treatment beds to put them in. So when we talk about the fact that there's a problem and we need to fix it, it's true, but all the solutions are really slow to build. There also isn't any new provincial dollars coming to operate any new programs. So I could start a new housing program tomorrow. I could build it. There's capital dollars out there, but we can't operate it. There's no money for staffing. So we're just still in this middle space. I think that quote of it gets worse before it gets better, that's the piece we're in right now. We have hope, we see things coming, but right now, if we don't as a community keep holding this together a little bit, we could succumb to a tidal wave.
Wow. Uh,
Sorry
That's
for the
pretty
bad
shocking.
news.
To be honest, it is. I think people will be really surprised to hear that.
Yeah,
And I think that also it's important to recognize that this isn't just a London problem, right? There
no,
are 444 municipalities across Ontario.
yeah.
I am sure that there
Over
are
80,000
issues,
people in total in Ontario.
80,000 people in Ontario. And my goodness.
It's a lot of
Um,
people.
so people that run organizations like yours, what do you need to happen? What do you need from I guess, municipal city council? What do you need from the provincial
Yeah.
government? What do you need from the federal government?
Yeah. I want to actually do a call out and say that the council and city staff have gone above and beyond. You're right. They prioritize this. A lot of taxpayer dollars have gone to fix this situation. And that's not a bottomless pit. We can't keep reaching into that pit. What is needed is provincial funding. Federal funding and municipality funding doesn't help in these contexts. This is healthcare, this is housing. Those are provincial mandates. We've been waiting for that for years. Nothing's been funded, and then every year it keeps getting decreased funding since 2018. So we do need something to shift provincially, and we're all literally just sitting around waiting for that to happen.
Okay. Well, time is not our friend. We're at the end of our conversation together. Thank you very much for
You're
joining us.
welcome.
And
Thanks for having me.
is there anything else that you wish I had asked or that you want to tell the listeners?
I would love to just do a shout out to all of the frontline staff who are working in all of the agencies in this type of work. These are folks that are doing the hardest job on the front line with, low salary, as much support as we can give them. But it's very, very hard work. And what they do is excellent. This work cannot be done by volunteers. These are skilled, trained, excellent humans. And I want to call out the fact that they are amazing and they're the reason why we can get up every day and still function in our jobs. So,
I can't think of a better place to leave it than just a huge shout out and thank you to frontline workers.
yeah,
This is really hard work
it
and it's
is
really important work, and I'm sure that they are saving lives every single day.
every
So
day.
thank you, Chris, for
Thanks, Matt.
being on the Matt Brown podcast, and
Love
I
it.
hope to see you soon.
I love it. See you soon.
Discover London Bicycle Cafe, home of family cargo and urban cycling. Test ride an e-bike along riverside trails to see how easy moving through our city can really be. London Bicycle Cafe at the Forks of the Thames. See you soon.
So that's that. I hope you enjoyed listening to this podcast, and I hope you know a little bit more about our city than you did a half an hour ago. Like I said in the intro, newsmakers and this podcast are for you. It's about all things local, and maybe some other stuff too. So please reach out and let me know what you think. You can email TheMattBrownPodcast@gmail.com. Many thanks to the Bicycle Cafe for coming on board as a sponsor, and to everyone who's reached out in these early days to offer your encouragement and your support. Today's podcast was a tough topic, a complicated, heartbreaking problem that's going to require an equally complex solution. Housing is healthcare. That's a phrase that's going to stick with me for a very long time. I'm grateful that Chris Moss was able to take the time to help us understand London's response to homelessness a little better. As she mentioned, they could use your help too. Please consider visiting londoncares.ca and making a tax-deductible donation if you can. I'm not sure if there will be another podcast between now and September, but you never know. So please reach out and tell us if there's something you'd like us to cover here or on Newsmakers over on Rogers Channel 13. Maybe you have a question about how things work. If you do, send it in to TheMattBrownPodcast@gmail.com. Your emails will come directly to me, and I'll read every one of them. And I'll respond as often as I can, too. So with that, thanks for listening. Don't forget to subscribe. Please share this episode on your social media and tell your friends. Until the next time, bye for now. Thanks for listening, and talk to you soon, London.